Hey guys, Tony Maritato here, licensed physical therapist, and in today's video I want to talk about cupping, the ancient Chinese art of cupping, and how it can affect or influence scar tissue formation, scar tissue development, and potentially the aesthetics, the look of your incision after it's been healed following a total knee replacement. So if you guys don't know me, my name is Tony Maritato. I'm a licensed physical therapist. I work here in Ohio. I also have a Facebook group called the Total Knee Replacement Support Group for Kind People. It's a free group. You're welcome to come join. It's an amazing community, over 7,000 people strong. So I got a question in that group related to a scar, and there were some fibrous, thick areas in the scar, and the member from the group was asking if cupping or instrument-assisted soft tissue mobilization might help reduce some of that fibrousness. Now, I tend to be of the mindset that there is absolutely benefit to the clinical research. The clinical research in this case, in my opinion, suggests that cupping and instrument-assisted soft tissue mobilization is probably no better than placebo. But that being said, I also believe that there's support for, what we see that works in the clinic, whether it be placebo, whether it be something that we just don't understand yet. So while clinically I cannot say that cupping or anything else is going to help or influence how scar tissue is going to be formed, because I believe your body is going to regulate that. Your body is going to thicken it or thin it. Your body is going to do what it needs to do. I will say that it's relatively low risk. There's very few recorded complications of any significant manner. I would say that when I've had issues with either pain in an area related to soft tissue or some potential healing, skin healing, things like that, I'll use cupping. I'll use it in my clinic with my patients. I'll use it on myself at home. I would never try to claim that there's good clinical evidence to support it. But because the risk of injury or complication is so low, I think there's relatively low risk of harm in using it, especially using it the way I use it. I don't use it to burst the capillaries. I don't use it to create those red splotches, purple splotches that you've seen online if you've done any research for it. I simply use it as a gripping tool. I use it as a tool to grip the skin, lift the skin, potentially facilitate some superficial lymphatic drainage, potentially use it to create a negative pressure on the surface of the skin. That's really all that I'm doing with it. And maybe you would say that I'm doing it incorrectly because I'm not doing it the way it's intended. But that being said, I'm going to share a video with you. I'm going to explain what I'm doing and how, when I do use it in the clinic, how I go about using it. So I'm going to keep this video on mute. I'm just going to kind of let it play through and I'll explain what's going on. So this is an individual who's got a sealed incision. It's completely healed except for one little spot that I'm going to avoid at the top of the incision. I put the leg into reasonable extension, if not completely straight, close to completely straight, to give myself some laxity in the skin. And then what I'm doing is I'm using this little silicone cup. These are my favorite. I do have the pumps, but I like these better, to create a little bit of a bubble, a little bit of a lift. You can see how, at least superficially, the negative pressure is drawing increased capillary refill, blood flow into the superficial layer, but I promise you it does not affect the tissue deeper than the most superficial skin layer. Now what I'm doing, and this is a dry cupping procedure, I'm creating a little bit of mobilization. So maybe if there is a little bit of scar tissue connecting the skin to the tissue below, think of cellulite, the way cellulite is a piece of connective tissue that's dimpling the skin because it's grabbing the skin and pulling it down. I might be mobilizing a little bit of that. I do believe that it also helps reduce some sensitivity if there are nerve endings in there that are highly sensitized for whatever reason. And then what I do, after I've done a little bit of dry soft tissue mobilization with the cup, I put a little bit of lotion on. This is a Biotone paraffin-based lotion. I spread it around. I create the suction with the cup again. And now this allows me to create a little bit of a gliding motion. Again, I find that I can feel areas of restriction within the skin, and it's just the skin. No different than when you look anywhere on your body, there's going to be little dimples in your skin. That skin is kind of tacked down in there. Now, we want it to be dimpled in. There are reasons for that, or else we would just be a big oval. Visually, it just, you know, your skin contours to the connective tissue of your body, but maybe there's some benefit to creating a little lift and a little separation in there. I would certainly never claim that it's reducing scar tissue. I would certainly never claim that it's breaking adhesions or anything like that. But at the end of the day, sorry for the ad, what I find, there's another video I've got here. Let me jump ahead. What I find is that when we can stimulate altered sensation, when we can create different mechanical feedback, like in this case, again, a lot of patients will develop pes anserine bursitis, pain on the inside just below the joint line. This has been a great way for me to reduce some of that sensitivity. I'm not saying it's reducing the inflammation. I'm just saying it's reducing some of the tissue sensitivity. So I love these little cups. I'll put a link to Amazon, an affiliate link, in the description of this video below for the ones that I use. They're a couple bucks each. Buy what you want to buy, but between a couple dollars for some lotion and a couple dollars for this silicone cup, I don't think you can really go wrong. And at least it gives you something to do that might potentially have benefit, but most likely doesn't have harm. If you have questions, if you have concerns or any other, want to know anything more, absolutely drop a comment in the video below. I'm going to put this into a printed article that I'll put on my website at totaltherapysolutions.com. And I'll look forward to seeing you guys on the next video.